We know that the rate of spillover and outbreaks is growing. The risk that those will translate into epidemics and pandemics as more and more people move around the world at high speed, and as more and more people encroach on nature with deforestation and the wildlife trade, intensification of animal agriculture, and so on. The good news is that there's a lot we can do about this, and that's what our coalition is focused on.
We know that well-managed conservation activities that address the needs of local and indigenous communities, curb illegal wildlife trade and logging, and promote rigorous disease surveillance can be successful for primary prevention. And at the same time, interventions like these yield positive benefits outside of zoonotic spillover prevention and reduction. For example, many of these interventions provide climate benefits by saving carbon sinks and help as well to slow biodiversity loss. But these multiple benefits often require working across sectors of governments and societies. Advancing these One Health approaches, including to address spillover prevention and reduction, is one of my Assistant Secretary's top priorities. To prove effective, a One Health approach must be utilized by all actors involved. It is an area of work our partners and colleagues throughout the U.S. government continue to elevate and to prioritize, including by recognizing the importance of reducing zoonotic pathogen spillover in our new National Biodefense Strategy and Implementation Plan, or NBS. The last 3 years have made clear that an outbreak anywhere is a threat everywhere. COVID-19 has taken lives, wreaked economic and social havoc, and has devastated communities. And we know that prevention is almost always more cost-effective than response, in terms of dollars spent, in terms of well-being, and in terms of lives.
Conservation and public health are two sides of the same coin. Conservation is public health. When we save nature, we're saving ourselves. Everything we need as humans to survive ultimately comes from nature. And if we don't have a planet to live on, we're not going to survive at the end of the day.
Our health is dependent upon nature and the health of nature. And what's changed over the last century and really accelerated over the last 30, 40 years is the impact of human activity on natural systems. In effect, changing the way in which we relate to nature, increasing the contact that we and our domestic animals have with wildlife. And as you heard in the video earlier, wildlife tend to be the reservoirs or source for most of the emerging infectious diseases. Most of the zoonotic diseases that ultimately end up in human populations originate in wild animals, and they make their way into people either directly or via livestock. And so the really number one thing to know is that all of these epidemics and pandemics that we're experiencing and will continue to experience are the result of human activity, of our actions on the environment in such a way that increases the contact we have and our livestock have with wildlife, and create opportunity for pathogens like viruses that would normally happily reside in wildlife populations that were living in a forest or any other ecosystem well away from people.
We would all rather prevent cardiovascular disease in the first place rather than experience that heart attack or stroke and have to get it treated in the hospital and potentially experience any type of major adverse event. And the same thing is for pandemics. We need to always be prepared for pandemics occurring. That's an inevitable part of our existence as humans and as pretty much any multicellular organism. But we can also prevent those pandemics from occurring in the first place, right? So we need to have a two-pronged approach. We need to be able to walk and chew gum at the same time. It's not that one strategy is necessarily better than the other, but the current model of just waiting for pandemics to occur and trying to respond to them and mitigate those deaths is clearly failing. Could not have been more prepared for a virus such as monkeypox virus, yet we saw it spread around the world, and the U.S. leads the world in terms of cases in 2022. Right? Even though we have a stockpile here of vaccines and therapeutics and diagnostics, and we have plans around addressing monkeypox. And there's a variety of reasons why just waiting for these outbreaks, epidemics, and pandemics to occur is a recipe for disaster if we put all of our eggs in that basket.
Accepted. I think what we need to start talking about is planetary health. And that's really what John and Neil have been saying, is that we can't look at one. We can't have our siloed approaches that we normally have, especially coming from the human health side. We really need to combine climate, environment, human and animal health together to have holistic approaches that will actually work to create a better environment for all.
And right now we are facing the convergence of 3 catastrophic threats: climate change, loss of biodiversity, and pandemics, that at their core all have a common etiology, which is the destruction of nature. And we have a decade left to turn this around. We have to start seeing conservation as an issue of public health.